Now, the Health Minister B Sriramulu has tweeted over COVID-19 cases in the state at this point in time. 195 Kannadigas have been evacuated from Dubai today, is what Sriramulu has said. They have returned, they have landed at Kempegowda International Airport. As soon as they landed in Kempegowda International Airport, 6 out of the 195 people have symptoms of COVID-19, is what he said. So those 6 people have been taken to Rajiv Gandhi Institute of Chest Diseases. They are being treated at this point in time. Well, for more on this, I'm joined in by my colleague Ashish, live from newsroom. Well, Ashish, at this point in time, 21 positive cases have been reported in Karnataka, and now 6 others who have arrived from Dubai. They have been taken to Rajiv Gandhi Institute of Chest Diseases. All we are seeing is that, at this point in time, everyone who believe or who show symptoms, they will have to come out and they will have to get themselves tested, because that is to ensure that India somewhere does not go to stage 3 of COVID-19 outbreak.
Well, absolutely, Suraj. On one hand, you have cases of COVID-19 proliferating all across the country. You have the people showing symptoms as well. And on the other hand, you have people testing positive for COVID-19 as well. Not just Karnataka, not just South India. You have the cases rising all across India. And having said that, ever since this entire situation has come out, the COVID-19 situation has really, taken over the world over the past few weeks. A lot of Indians, especially Kannadigas, are stuck in a lot of different parts of the world, and the Indian government and also various other agencies are making sure that all of these people are safely brought back. But what exactly is the fear is that all of these people, they are stuck in countries which are contaminated, which are infected by COVID-19. So are we really bringing in the virus as well? On one hand, you have international flights being banned, a lot of people, states being locked down and all of that. On the other hand, you have people being brought in from these countries instead of being kept there and treated and made sure that they receive good treatment there. So that discussion is for later, but as of now, like you rightly said, Sriramulu has tweeted that 195 people from Dubai have been brought back to Bengaluru. 6 of these have shown symptoms of COVID-19. Rest of these people also are, there might be possible contamination, because if you have 6 people amongst 195, there is a particular stage wherein you reach and show symptoms. Before that, you might have the virus, but you might not show the symptoms. So this is why, as you rightly said, 6 people have been taken to RGICD. The remaining people also, they have not been discharged. They have been taken to the Akash hospital, where they have been kept at isolation wards, and there they will be observed for the next few days. And the doctors, once they are completely convinced that okay, these people do not have any sort of infection, they are not infected by COVID-19, only then these people will be discharged. But having said that, of course, these 6 people that you are talking about, they have shown very strong symptoms of COVID-19 and could possibly be positive cases. But all of that is speculation as of now. They are being kept at isolation wards in RGICD. On the other hand, the other people have been separated. They are kept at a completely different hospital, where they will be observed for the next few days, and the doctors will really monitor the situation and see if these people really show symptoms. And once they're convinced that there is nothing really to worry about, they'll be discharged, Suraj. Also, this comes in the backdrop of 26 people being brought back to Bengaluru, 26 Indians being brought back to Bengaluru yesterday, if you remember. That also created quite a scare, because a lot of rumors started doing the rounds that okay, these people, every one of these have symptoms of COVID-19. So there was a lot of panic following that as well, but those people were immediately taken to RGICD through through a BMTC bus. All of those people were taken to RGICD. So all of these people are being brought into the country as of now, and at the same time, you have a lot of panic, that is going around. A lot of people really objecting to this, saying that why do we have to get in people who are in infected countries? It probably means that we are somehow importing coronavirus. That is what a lot of people are, that is the reaction that we are getting from all spectrums. But having said that, the government is doing what it feels it's doing right, and it is making sure that all of these people, once they are in India, they are isolated completely. They are not allowed to go out into the public. They are taken to hospitals. It is made sure that these people are completely free of coronavirus. Only then are these people allowed into the public space, Suraj. So yeah, like you rightly said, the health minister has tweeted about this, and he has made sure that he gives complete details of what is being done with not just the 6 people who shown symptoms, but also the remaining others who might possibly show symptoms over the next few days.
Well, one thing, Ashish, yes, till now people have been supporting Janta curfew today. So everyone's staying indoors. All of that is fine. But over the past few days, we have been seeing how the number of cases have been doubling. On one side, we can take it as a positive sign that people are being more aware and they're coming out getting themselves tested. On the other hand, people should also realize that the cases are increasing by the day. So that means people should be more responsible at this time because it is in their hands. If they ensure that they stay at home, they stay safe, they stay in clean environment, they keep themselves clean, the hygiene they maintain. If all of this is done, then probably we can contain the virus. But if not, we will be seeing many more cases in the coming days. So there is a pro, there is a con as well. People need not panic, but at the same time, they will have to ensure that they remain safe, they remain indoors, and they contain the virus at this point in time.
Well, Suraj, that is one important aspect of it because, the Janta curfew that has been called today is more of an awareness campaign that is being done by the Prime Minister. People need to be made aware that India right now is at an extremely critical stage wherein, the countries like Italy and Iran, which are now seeing so many deaths, so many cases all throughout the day, every single day, they have more and more cases coming out, more and more deaths. All of these countries were at the same position that India is at right now. The only difference is right now, we have an example, we have something to look at and really learn from. We have countries like Iran and Italy to look at, and we really need to take, lessons out of all of these and really understand that, this is an extremely critical juncture for the entire country. India, if, God forbid, in case it enters stage 3, a densely populated country like India, you can only imagine the consequences that could really, come out of that. So, this is something, the Janta curfew is something that the Prime Minister has brought about. But having said that, people should not really, limit it to one single day. Just because Janta curfew gets over today does not mean everyone again forgets about social distancing. Everyone thinks coronavirus is out. Everyone starts doing the same old routine. That is not the case. People need to realize that, this is something that has to carry on for the next 2-3 days. Even though there is no Janta curfew for the next few days and there is no lockdown as such, people really need to restrict themselves, restrict their travels, restrict their interactions, and make sure that they really stay out of places where they feel there could be some sort of infection. And the social distancing, again, that's what I'm talking about. Social distancing is the key, and once people do realize that it exponentially grows. It is not something that is a one-to-one contact. If you come in contact with 10 people, those 10 people come in contact with 10 more, so it only multiplies further, and after a point it goes into a situation where you can just hold back and just hope for the cases to come down. So clearly India does not want that. We do not really want to go into that situation, and that is why Janta curfew has been called today, so that people for one day they realize the importance of social distancing, and this carries on for at least a couple of weeks till India is back into the safe zone and back where everything is back into control and does not really get out of hand, Suraj.